Fletcher Allen is a level 1 trauma center in Burlington, Vermont, and we have a parent organization called Fletcher Allen Partners, and it's made up of several hospitals in central Vermont and as well as upstate New York. Probably the biggest is keeping up with the changing technologies. So physicians and clinicians often say that it's their job to treat the patient, and we need to do that in a secure fashion. And right now, the use of medical devices in that treatment of patients is important to make sure we do it securely. So one of the biggest ways is for them to understand the impact on the patient of securing their information. And one of the things I usually tell folks is that if a patient doesn't trust us with their information, they won't come to us. And so if we want to treat them, we need to make sure that we protect their data so that they're willing to come to us in their time of need. And then when they do come to us, we need to make sure we have the right information available at the right time to treat them. And then lastly, we need to make sure that information is accurate and that hasn't been affected by a virus or a hacker or anything like that, and that information can be trusted. And that's really where the major importance is. I don't want clinicians questioning the information that they're looking at and whether or not it's true. Part of it is the unknown, the threats that we don't know about, and the ones that are, whether it's a new virus that's running around that we're not aware of, or a new bug. The changing technology is so quick that I often wonder if the security has been ingrained into it, if it's an afterthought. The other one is with medical devices. I mean, 10 years ago, certain medical devices never plugged into the network. Now they do. So are they supported with the adequate security to make sure that they're safe? An IV pump. If it's plugged into the network now, it can be reached with a virus. So I did information security in the Army, and the biggest lesson to me is the importance of it. If information is released, soldiers could get hurt. You certainly don't want the enemy, if you will, to know where the soldier's going to be, what time they're going to be there, what type of equipment they're going to have. Someone can get hurt. It's a life or death situation. The same thing applies to healthcare. To me, I want to make sure when that patient comes in the door that they're getting the best care possible, and that their information has not negatively affected that care. So whether it's been identity theft or worst case scenario, that a hacker or a vendor makes a change to a network, a production network, and the information is reversed, and that we're treating a patient with someone else's information. So ideally, we want to make sure that we're maintaining that confidentiality and that availability and that integrity. Absolutely. I mean, I think one of the biggest things is it's a very regimented process in structure in the military. We have certain regulations we have to follow. We have a very organized chart as far as who reports to who, and I take all those things, all those lessons learned from my time in the service, and I look to apply them to what I do every day. So I've created a team with a structure that I feel best fits how we're dealing with our information security at Fletcher Allen. And then the other thing is trying to make sure that we have the appropriate policies and procedures in place so that it's clear when employees come on board that this is what's expected of them, and then they can find that information easily so they know.